Hello you guys, welcome back to my channel and welcome to anyone who's new. My name is Zanele. So I am a registered nurse and I am here in South Africa documenting my life as a nurse. And on this channel, we're doing nursing related content, we're doing career related content. On here, we also know that we are doing educational videos. And today I am coming at you guys with a slightly different video. I am here to talk about careers that are also in health, which we never ever think about whenever we're thinking of working with people or helping people. Often when you think about helping people and working with people, you're thinking nursing and medicine. But today I am here to share 6 careers that I would recommend young people to follow within the health sector. Careers that contributes to the holistic wellness of a patient. So without wasting any time, let us get into the video. By the way, if you're new, please do not forget to subscribe. We are on road to 5K. Alright, so the first career that I would suggest or recommend to young people. Firstly, let me say this. There is no particular order. I'm also not going to be talking about salaries, how much is this person making, who gets paid more. I honestly do not believe that it should be money that we're chasing, but it should be happiness, fulfillment that we are chasing, and then money follows, right? I'm also not saying that we shouldn't be paid for what we're doing. We shouldn't be paid simply because we're passionate. No, but I'm a firm believer of doing something that you truly love, so that it doesn't feel like a job when you are doing it. Do it while you love it so that it doesn't feel like a job when you are doing it. And when the money comes, it will actually feel like a blessing. So the careers that I decided to gravitate towards are careers that you only have to do an undergrad degree. You don't have to do a postgrad studies on that, because I understand not everybody is in a position of moving immediately from undergrad into postgrad. For an example, if you want to be a clinical psychologist, there is no way you can just do your undergrad and already be a qualified clinical psychologist. You need your honors, you need your master's degree, and some of us, we come from disadvantaged backgrounds that makes it impossible for us to afford to do our honors. As soon as we graduate from our undergrad, we need to secure the job so that we can be able to take ourselves to study further more into postgrad studies. So the careers that I've picked here are careers that I am certain, I'm sure that immediately when you graduate from your undergrad, you will be able to get your job within the health sector. So yeah, the first career that I would encourage anyone to do in no particular order, it is pharmacy. Pharmacists, they go to school for 4 years to do a degree in pharmacy. What they do is they issue out or dispense medication. You see how doctors write a prescription or nurses write a prescription, give it to you, and you walk to the pharmacy to go collect your medication. Those people that gives you your medication are actually called pharmacists. So you can do your degree in pharmacy and issue out medication to your clients. They also like calling us out as doctors and nurses. Like if we do any nonsense or we prescribe things that are not supposed to be prescribed, they also are able to advocate for the client. They look at our prescriptions and see if it is financially conducive for the client and it is also the best route to treating the client. So go ahead, visit university website and see what pharmacy requirements are, and also do your own research on what pharmacists do in depth. The second degree that I would advise people to do is radiography. I also advised the mother of my niece to actually go for this qualification. It is quite an awesome qualification, but people don't talk about it. I don't think people talk about radiography enough. But this is a 3-year degree program in other universities. In other universities, it's a 4-year degree program. So you also need to go back and check which universities offers it and for how long. But I know TUT offers it for 4 years. Some offer it for 3 years. I think UJ offers it for 3 years. So what do radiographers do? Radiography is if you are into helping patients, right? And at the same time, you are into technology, right? So if you are someone that truly loves tech, into medicine, into helping people, then radiography would be the degree that I would encourage you to go for. This is where you get to take pictures of skeletals. That's literally how I explain it in simple terms, but it's not pictures. But yeah, you take pictures of skeletals. You are able to see a broken bone. Obviously, you cannot see a broken bone with your own naked eye. So we need radiographers. As nurses and doctors, we need radiographers to show us the internal human beings so that we may be able to make our own diagnosis. So like fractured bones, tumors, all those jazz, those are the things that radiographers do. So if you are into technology, if you are into helping people, in love with tech, I would advise you to go ahead and study radiography. Is it radiography? Yes, radiography. And then the third career that I would advise young people to go for is becoming clinical associates. What clinical associates do, basically, they are intermediate between a nurse and a doctor. As a nurse, I have a scope of practice, like a document that governs me on which procedures am I expected to do as a registered nurse, what do I need to do, what do I not need to do. So are doctors, so are clinical associates. So clinical associates are actually, I normally call them assistant doctors. They probably hate that, but there are certain procedures that clinical associates are able to do which doctors don't have much time on their hands to do. For instance, lumbar puncture, removal of lipoma, and like these tiny little surgical procedures, clinical associates are able to do those. They're able to admit and discharge patients. They're able to prescribe certain medication and all that. So they are like an intermediate between a nurse and a doctor, because remember, my scope of practice, there are certain things I'm not able to do, I'm not allowed to do. For instance, lumbar puncture, I'm not allowed to do it. But with a clinical associate, they can do it. It's not a complex procedure, but unfortunately, nurses, we're not allowed to do it. So if you are going to be a clinical associate, you will be an intermediate between a doctor and a nurse. You see what I mean? Like procedures that nurses don't do, doctors don't have time to do, you're gonna do them. I don't think that sounds right, but yeah, that's basically how you can explain a clinical associate. They study for 3 years, and I know VETS offers this career. I also know that University of Pretoria offers this career. So if you want to be a doctor but you don't want to go for 6 years or 7 years, you can actually do clinical associate for 3 years. And the fourth qualification that I would encourage individuals to do is actually social work, right? If you are into psychology and you do not have the money to do your undergrad, postgrad, and masters, and if you don't have the money to do all of that, I would suggest that you take the easy route, study social work. This is a degree that takes 4 years in all varsities or universities. So enroll yourself in social work. This is where you get to deal with the social aspect of a patient. If a patient is not treated well at home, if a patient doesn't have income, if a patient doesn't have the basic needs of human beings, that's where you step in as a social worker and become a lifesaver and become an angel. Also, social workers, they are able to step into the psychological aspect of an individual, like in terms of counseling. When we don't have a psychologist, they are able to execute those tasks. Hence, I'm saying if you are into the social psychological being of an individual, then I would suggest that you go for this qualification. The degree also takes 4 years in all universities. And another qualification or career that I would suggest individuals to go for is dietitian. Become a dietitian, my darling. Tell us what to eat and what not to eat. Create those healthy eat plans for us. treat a patient in a lifestyle modification plan. These are the people that tells us to exercise. These are the people that tells us not to eat too much sugar. If we are diabetic, not to eat too much starch, not to eat too much of this and that, if we are obese or malnourished. So if you are into those, you have passion for health and fitness, at the same time you want to be in the health sector and be helping people, I would suggest that you go for this particular qualification. The degree, it is 4 years for this particular qualification, and you'll immediately get a job as a dietitian. The last one that I would encourage people to go for, it is occupational therapist or physiotherapist, OT or PT. Yes. So occupational therapist is someone that encourages the client on a journey to healing. Like, they help you to realize your ability to exercise your full potential to healing and injury, right? While a physiotherapist is someone that uses the manual technique to help the client to recover from an injury. So these two, they are quite similar, but there's definitely a difference between the two of them. So these are also degrees that I would encourage people to go for and study these, and you will immediately be able to get a job and also help people, and also be part of what we call a multidisciplinary team in ensuring that our people, our humans, are healthy holistically. So it doesn't only take a nurse and a doctor for a patient to be whole. It actually takes this group of people, including a nurse and a doctor. But I'm here to encourage you that whenever you think of working with people or of coming into the health sector, don't only look at medicine or nursing, because sometimes those two don't work out. Just know that you also have other options. I hope this video will help someone make an informed decision about their careers, their future. And yeah, if you enjoyed it, please do give it a massive thumbs up and share it with young people that are upcoming and who are undecided on what careers do they want to do or what career path do they want to take, but they are certain that they want to work with human beings. Please do share this video with them. And I hope if you've identified any career that seems to be interesting to you, you will take time to research in depth and see if it really suits your personality. Remember, I said you first need to go for what makes your soul burn, what sets your soul ablaze, what gives you purpose, what gives you passion. Because if you don't, then you will be frustrated and you will hate your job. By the way, these are not the only health related courses that are there. We also have lab tech. We have quite a lot in the health sector. Please go ahead and research more and make an informed decision. I love you guys very much. Let me end this video. I'll see you on my next one. Do not forget to subscribe if you are viewing my videos for the first time. Can we get to 5,000 subscribers? Let me be ambitious and say by the end of 2021. Bye guys.